Dr. Pankaj Arora. I'm an emergency physician, a founder and CEO of Ryde Specialist Emergency Clinic. I've been an emergency physician for the last 28 years and have worked in 4 different continents. And my passion is to develop healthcare systems to help acute care in the community. I've been instrumental in developing emergency medicine as a specialty in countries which were developing and did not have emergencies as a specialty. During my career, I've come across various models of care and development of emergency medicine from a scratch casualty to a strongly academic emergency medicine. I've been in Australia now for the last 20 years as a staff specialist in Royal North Shore Hospital, as a director of emergency medicine training for 5 to 6 years before I ventured into a community model of care of emergency medicine called as Ryde Specialist Emergency Clinic.
2 million patients visit our state emergency departments, but with hospitals overstretched, many are forced to wait for hours. Now, patients have the option of skipping the queues by visiting a walk-in ER at Macquarie Park.
It's an emergency department, but not like you know it. No wait times, no triage system, just immediate specialist care. The new Wise Clinic at Macquarie Park is a walk-in centre with 15 senior emergency physicians plus a network of specialists on call. With 70% of patients who present at hospital emergency departments never getting admitted, this clinic caters to those with non-life-threatening conditions who still need urgent care. Wise is equipped with blood testing, pathology, X-ray, dental X-ray, CT scan and ultrasound to avoid referrals, delays and to fast-track results.
Ryde Specialist Emergency Clinic has been working in this area for now 7 years and seen over 70,000 patients. The origin of this idea came from a group of emergency physicians working in the local area wanting to serve better their community. In reality, 70% of the patients who present to emergency department do not get admitted or use the services of the hospital, as in the inpatient services of the hospital. If you take an example that the emergency department is the ground floor of the hospital with all the allied services and the diagnostics and the support services of the specialist. And if you wanted to pull out the ground floor of the hospital and bring it to the community, you will need all those multidisciplinary elements in that for it to be successful. And that's the modeling we did 7 years back to make sure when the patient arrives in the setting of acute illness, they get that multidisciplinary approach to that patient in terms of rapid access to radiology, pathology, and a specialist care. And that kind of made sense to us because without all these components to that, we can't take decisions and the patient has to be getting repeated care from different services of our health system. And I think this model actually ended up being a very efficient, cost-effective model where we have been able to serve 70,000 patients within waiting time of less than half an hour, and their results coming in less than 60 minutes. And that has provided a satisfaction in the community, and they are walking out of an emergency acute situation fully satisfied and with their tied up follow-up care, which also happens in the same facility. So like we have fracture clinic here, we've got chest pain clinic, we've got TIA clinic, we also have early pregnancy clinic where we can actually look after our patients following that acute episode as well, which leads to a complete care rather than a fragmented care, which we feel is a big problem in Australia.
A key feature here is such a quick turnaround in results, isn't it?
Correct. So the clinic has been modeled around to see acute patients, so that doesn't make any sense to delay the results by 24 hours or something. So our radiology department, if you see here, is active whole 12 hours and the results are being delivered within an hour of a CT scan or an X-ray. At Wise Specialist Emergency Clinic, Macquarie Park, we have roughly around 100 people who provide the service for these acute illness patients present with. Out of them, 50 are our employees and rest of them are people who are service providers. They come from various range of specialities like cardiology, neurology, orthopedics, and radiology, pathology, and dental as well. And our physiotherapy unit is growing, and it also takes up to 10 people to provide that service. The overall positioning of Wise Specialist Emergency Clinic in the healthcare system is clearly between the general practice and the hospital medicine. There are a wide variety of models which are out there, including urgent care, after-hour services, freestanding emergency departments, which grew very fast in Texas in the last 10-15 years. Amongst this range of modeling, the emergency specialist clinic has kind of serviced a group of patients which actually really need an emergency department and is not a replacement for a GP practice or any other after-hour needs of the patient. It actually addresses the acute care need of the. What it has done in the healthcare system is it's made these patients' care more efficient and cost-effective. To come to an emergency department of a public hospital, the cost of treatment, average cost of treatment, could be up to $700 to $800. Whereas at Wise, we have subsidized, or we have taken various models of funding, and the effective cost to the patient care is approximately around $500. So that is a big impact on the economy of each presentation of emergency patient to a health system. And what it has also done is it's reduced the pressure on the health budget, because the part of the funding is done by patient's pocket and part by Medicare, and part of it also done by health funds. So having these three funding models serving the needs of the patient care also makes it very cost effective. The other thing which it does is prevents representations and what I call it as re-dipping into the health system again and again. You are seen by one health professional, then second and third, but the final care has never happened. What happens is the final care gets delivered and the follow-ups get arranged. So I think it's a very cost-effective system, and also it does save patient time, and health funds are equally distributed amongst the pocket of the patient, health funds and Medicare. It was challenging for us to scale up this model. Our first center was in Macquarie Park, which we considered as an incubator for our model, as a new model of care in Australia. But following that, the biggest challenge was how can we scale it up or replicate it in another state and in another population. So that came to us about 3 years back, when some of the emergency physicians at Gold Coast were interested in working the way we are working here. So in partnership with them, it took us about 3 years to model the second center on lines of what we have done here. And that took us through the journey, which gave us a lot of learning, exploration of data, and positioning it in the community in the right manner.
Twist, a groundbreaking new health service slashing wait times for Gold Coasters requiring urgent medical attention.
Dr Pankaj Arora bringing his game-changing walk-in specialist emergency or WISE clinic to Robina this week. It's only the second of its kind in the country, offering urgent care for patients suffering non-life-threatening symptoms. Blood tests, x-rays, ultrasounds and CT scans are conducted on site.
Now the Gold Coast Centre in Robina has been functional for 6 months and is seeing average up to 20 patients a day, which is a very fast ramp-up period compared to what we faced in Macquarie Park. Taking it from there, I think the learnings which we've had in the creation of these two centres, we would like to have at least 20 to 50 of these centres across the country, and our short-term goal is in next 5 years to open at least 10 more centres in the different states of Australia, including Victoria and Western Australia. And I think given these two centres have come up and taken their time of 7 years and given us a learning through the data, safety net and creation of our network, I think it'll be very easy for us to scale up to 10 to 15 centres in the next 5 years. Currently, we have seen there's a lot of interest in starting urgent care in Australia. And to have a complete understanding of what urgent care means, we have to look at the history. In the United States and UK, there have been a good number of urgent care opened in a shorter period of time. Especially the United States has got an example of more than 15,000 urgent care in the country. Now, if you look at the history of American health system, the reasons why these urgent care became very popular was lack of primary health care, lack of GPs or family physicians. And that led to an alternative system of urgent care where busy people would want an appointment with a doctor at the earliest. Whereas in Australia, urgent care term was sort of played around with in 2011, and there was funding which came from various directions, and that kind of could not prove the point that it helps emergency departments. The reasons are various. The first of the biggest reasons is we have GP services which are available. There are multiple GP clinics which are super GP clinics who have a setup similar to an urgent care center, and they provide the service, but that doesn't still impact the emergency department visits. So a replacement of a system which already exists under a different name may not be able to solve the problem which we are trying to solve. It may just end up spending more in these intermediary services which don't have a final outcome to that. So I would just sort of think that we have to be a little bit more diligent and more have a look at the data a little bit more deeply to see if the answer for Australian busy emergency department is to replace it with urgent care or to provide a proper specialist emergency care. So I would really sort of, from the data I have with me and from what I have looked at, I'm really skeptical whether urgent care would make any difference to emergency presentation in Australia.